Seattle was the original epicenter of COVID-19. We were the ones to first experience this pandemic. Particularly for the Native community, we did not get the resources that we needed when COVID first began. The Seattle Indian Health Board was one of the very first in Washington State to get the Moderna vaccine. That didn't happen by accident. We have been fighting to ensure that we are getting what we need in order to fight COVID within our community.
I actually had a panel interview with our Native families. Our youth were the ones who said, we need you to take the vaccine first. We want to know that you're not asking us to do something that you wouldn't do yourself. So I was the first person in the state of Washington to receive the Moderna vaccine. I think the more people who can demonstrate that the vaccine is actually safe and effective, the better off we'll be.
The vaccine has been tested with thousands of people across the United States, very strict clinical trials, and Native people were included in them. These vaccines are safe. They do have side effects. You need to make sure you know what those side effects are. If you are in one of the groups that could be adversely affected, your providers here at the Seattle Indian Health Board will let you know whether or not you should be vaccinated.
When you call the Seattle Indian Health Board, you can choose two different options. One is if you're experiencing symptoms and you need to receive a COVID test. And two is if you want to receive a COVID vaccine, you can press a button to actually get somebody on the phone to get signed up to get a vaccination. At this time, it's really important for folks to get enrolled as patients at the Seattle Indian Health Board because that's how we can be able to provide the vaccine. If you're an elder, especially if you have any illnesses like diabetes, heart disease, or asthma, please come in and get your vaccination. The next phase rollout will be Native 18 years old and up. If we can get enough of the vaccine following that, then we'll open it up to everybody.
We're not more likely to get COVID or to die from COVID because we're Native. Being Native is what makes us strong. Right now, it is so important for us to take every necessary precaution to ensure a great future for our next generations.
The Seattle Indian Health Board exists to serve all of our relatives. From an Indigenous perspective, we're all related. So I'd like to invite you to come to the Seattle Indian Health Board and become part of our family.
What I love about Seattle Indian Health Board is the in-depth care provided. It is not just patient and employee care, it is all relatives. We are all family and we take care of each other that way. I also enjoy the fact that I can be my strong Indigenous self and represent my culture while working in an environment within the medical care. I love coming to work and being able to meet the needs of people who truly deserve and respond to that in the best way I know how. I'm very excited for the future of Seattle Indian Health Board because I've seen it grow over the last 10 years. And with integrated care and wrapping everything in traditional medicine and our growth to be in a larger building and satellite sites, it fills me with joy to know that we'll be able to touch more people and offer more services and be everywhere that we can be for American Indian Alaska Natives and urban Indians like myself. So.
Nohit Darek, Iriwe Tude Tatasa, Dakatu de Waki. Hey, hello, everybody. My name is Howie Echo-Hawk. I use they, them pronouns. I'm a member of the Pawnee Nation of Oklahoma and an adopted member of the Athabascans in Alaska. Shout out to Lorna if you're watching. I'm very excited to be here today virtually in all of your homes. Well, look at that heart from Sandra. Hi, Sandra. How are you? It's good to see that there are Native people watching. We love you guys here at the Health Board. You know that we do this all for the love of Native people, and this is our week-long event to honor members of the community who have done a lot for us. This is the Adeline Garcia Community Service awards. Normally it would be a luncheon, but we're all in COVID, and this is we're trying to be safe, and so we're going to make sure that we do these things in a safe way, but still bring that kind of native flair that we always do, and have a lot of fun with it. So we wanted to do this week-long event where we are going to have different talks with artists who have performed at the Indigenous Peoples Festival last year, and also honor each of the awardees this year with their own interview. And those will be happening throughout the week. But today we are very lucky to be able to talk to Abigail Echo-Hawk, who is the Executive Vice President of the Seattle Indian Health Board and my next door neighbor. We are related, and she is just an incredible person who has recently been seen in Vogue for this dress that you can now see on your screen. And I'm not going to get too much into that because Priya Frank, who is the Director of Equity, Diversity, and Inclusion of the Seattle Art Museum, will be interviewing Abigail later. Hi, Shelley. I'm just going to keep on saying hi to people. Jeff keeps on bringing those things up. So please donate, though. This is a fundraising event. The Seattle Indian Health Board is a vital part of our community here in Seattle in the Northwest. It is a very important part of our healthcare as urban Indians. It has been providing amazing healthcare throughout the pandemic and providing the Moderna vaccine for a while to our communities. And so please donate. As you can see, there's this sihb.org/donate. Our goal is $100,000 for this week-long event. We really, all that will go to providing healthcare and continuing to be an amazing organization that it is. Quickly, I would like to thank our sponsors for this event. I want to thank the Community Health Plan of Washington, Pyramid Communications, Arcora Foundation, One Digital Health and Benefits, Sea Alaska Corporation, AmeriGroup, Chief Seattle Club, Salal Credit Union, Molina Healthcare of Washington, Decision Point Planners, Spectrum Pension Consultants, Cambia Grove, Building Changes, and Agatha Consulting. We want to thank you all so much for sponsoring this event. It's again, normally it would be a whole luncheon, and we can't wait to do that again with you soon. But for right now, this is our way of being there with you. I want to talk really quickly about who Adeline Garcia was. Adeline Garcia, the awards are in her memory. She was one of the founding leaders of the Seattle Indian Health Board and just in the community in Seattle. And we recognize other leaders who have contributed towards Native issues in this community every year. And so we're proud to honor her legacy and her commitment to Native people. I wanted to read a quick quote from her where she was talking, and she says, "We just needed to get together and find strength, to be someplace where somebody isn't going to be criticizing you because your skin is not the same color as theirs is, and you don't speak the same way. We just needed a place where we were comfortable and accepted at face value." That was important. Adeline was an amazing woman. We will be able to hear from Adeline's daughters on Friday, so please tune in on Friday and every day, 12:30 to 1:30 for these interviews. Next, we have a short video about the Health Board, the history of the Seattle Indian Health Board. And so, Jeff, why don't we have that go?
Seattle Indian Health Board rose from the social justice movements of the late 1960s and early 70s.
It was started by a group of these dedicated, passionate volunteers.
We did not have computers then, and you could count the number of doctors on one hand.
The work that Seattle Indian Health Board was doing was just awe-inspiring. Clinics throughout the country have benefited from the work that's being done here. It was a time of assimilation. The Relocation Act really encouraged Native people to move out of reservations and into urban areas.
They gave everybody a one-way bus ticket and said, if you want better access to economic opportunities, you want to become a doctor or a lawyer, we will give you a one-way bus ticket from your reservation into 12 relocation sites. When Native people arrived, they were not met with those promises.
A lot of Natives in Seattle were finding that the jobs that were promised weren't here. Education wasn't a possibility for a lot of people.
The benefits we were promised as American Indian Alaska Native people were being limited by the federal government to only tribal lands.
We lost a lot. Access to our land, we lost a lot of our relatives. This was really a form of cultural genocide.
But we did what we do best. We came together, all different tribes, and said, just because we live in cities doesn't mean that our benefits disappear.
The government owed something to us. Nobody else is gonna give us the things that we need. We really have to provide that for ourselves. And those agreements listed healthcare.
One of the most beautiful things about the story of the Seattle Indian Health Board is how Indigenous women came together to say our people deserve more.
Bernie White Bear partnered with the American Indian Women's Service League to start to form free clinics.
They literally moved a file cabinet out of a file room and started providing services to our people.
When they got their 501c3 and became the Seattle Indian Health Board, Bernie White Bear was the first person hired as the executive director.
Since that time, we have grown from moving that file cabinet over to now we're a $32 million organization.
What is the next 10 years going to look like? What's the next 20 years going to look like? That is our responsibility to continue what they started to ensure that we are not only here 50 years from now, but 5,000 years from now. That is the blessing that we have here at SIHB.
All right, everybody, that was a great video. We'll be showing you lots of more exclusive videos like that throughout the week, so please tune in to these events or watch them later. Share them with your friends. Share them right now. Share this video and tell people to tune in and hear what we're doing at the Health Board, and also donate, please, again. So next we have an interview with Abigail Echo-Hawk, the Executive Vice President of the Seattle Health Board, by Priya Frank. Priya is my friend and a very cool person who said I did not have to read her entire bio, but I'm going to now. And so Priya Frank is the Director of Equity, Diversity, and Inclusion at Seattle Art Museum, where her focus is on organizational development, program curation, and racial equity related initiatives across the institution. Previous work at Lucid Lounge, UW-Bothell, UW Office of Minority Affairs and Diversity, and the Meany Hall of Performing Arts have influenced her passion and heart for this work. Priya also went to the same college as my sister and same program or similar program.
Affiliated
program. I want to read this last thing though. Priya loves to dance, travel, make chalk art, and cultivate beauty wherever she goes. Thank you so much for doing this, Priya. We're very excited. I'm going to go ahead and let you take it away.
Awesome. Thank you so much. What an honor to be here with you all to kick off such a special week, and to do so with the amazing Abigail Echo-Hawk. Hi, Sandra. Good to see you. So many friends out there. Thank you so much for joining. So Abigail is an incredible human and somebody that I've known of for many years through UW-Bothell, where she's an alumni, as am I. And I can imagine that similarly, for me, that time at UW-Bothell really just created so much for me in terms of just heightening my want and need to do community work, and to really just hold those values of community and racial equity dear to my heart. And so I'm excited to talk more with Abigail about some of the incredible work that she does, and the amazing dress that was created, taking something that was really devastating and creating something, a piece of art truly that is a representation of hope and resilience. So Abigail, welcome. Thank you so much for being willing to do this and to have me get to interview you. I'm so honored.
I'm so excited. I didn't know you were UW-Bothell alumni, and so that is awesome. And it was definitely, I will say, UW-Bothell was the very first time that I realized I was smart with some of the teachers there. I didn't experience that in the way that I was had my previous education, where I was treated badly because I was Native and I was a woman. And it was the first place that I realized that I was actually pretty dang smart. And I really appreciate the teachers there who encouraged me and really facilitated me in moving forward to where I'm able to serve my community today.
Mm-hmm. Oh, I couldn't agree more. Just such an impactful experience. Can you tell us a little bit of your background and the work that you do at Seattle Indian Health Board?
Yeah, I'm so lucky. Like I said, I was blessed to be introduced by my sibling in our Pawnee traditional way. For them to introduce me is not only the greatest honor and privilege for me, but it is also their traditional responsibility. And so it is such a blessing to be able to have them to introduce me. And as they said, we are members of the Pawnee Nation of Oklahoma on my father's side, but I was born and raised in the heart of Alaska amongst the Upper Otna Athabascan people who adopted our mom and brought us all in with love, and were part of raising me. And I left Alaska when I was 18, soon became pregnant here in Seattle, followed my sister, and experienced really discriminatory health care at a local hospital here, where I was terrified. I went into this hospital and they checked my arms for drugs. They questioned me about whether I was drinking. They wouldn't believe me when I said I wasn't. The moment they saw my name and saw I was Native, they assumed that I was causing harm to my unborn child. And it wasn't until my sister got me to come to the Seattle Indian Health Board at the age of 19 that I walked into a place where I knew I was loved, I was cared for, and where I birthed a beautiful baby. And so I was blessed to come back here 4.5 years ago to an organization that once served me in my greatest time of need, and come back and be able to provide that same service. So right now, I serve as the Executive Vice President, Seattle Indian Health Board, incredible primary care services, medical services, traditional Indian medicine. We've got it all. In addition to be the only National Tribal Epidemiology Center, which we do data evaluation and research across the nation for the urban dwelling American Indians and Alaska Natives, which is about 71% of all Native people live in urban settings across the United States. So I'm what they call in the Western world a scientist, but I consider myself a storyteller, and a storyteller of health. And I follow thousands of years of storytellers. So that's the work that I get to do here, to serve our relatives when they walk in the door, for them to know, like Sandra's saying, Seattle Indian Health Board is home, Seattle Indian Health Board is love, and Seattle Indian Health Board is where we can come and be seen for our full Indigenous selves.
That is incredible. What a powerful full circle situation where something that helped you so much, now in turn you're getting to help lead. That is really powerful and a real testament of the journey. So incredible. You speak a lot about decolonizing data. Can you tell us a little bit more of what that means within your work?
Yeah, so when we talk about decolonizing, I think people like to use it for this cool metaphor, like let's just put decolonizing in front of everything. But that's not what it is. Decolonizing isn't a metaphor, it's an action. And so I realized that the work I did, and before I came to Seattle Indian Health Board, I was working doing research at both Washington State University and then Washington State University. As well, I did some awesome stuff and made some good changes. I was working in a Western bureaucracy meant to eliminate Native people. It was built on the land and the blood of Native people, on the enslavement of African American people. I can't decolonize that. So when I came to the Seattle Indian Health Board, Esther Lucero, our CEO, she told me, do what you know how to do, what your ancestors taught you, what your elders have taught you, and you can do that as an Indigenous person from that place. And it changed my world. It changed my life. We only do data research and evaluation that is grounded in traditional value systems of we were always data collectors, we were always scientists, and we did it for one reason only, the good and the well-being of our people, to be healthy, whole, and thriving, not just for this generation, but for all of the future generations. And so we make sure that we are only doing strength-based information. We don't go to look to see how bad off we are. We look for where we are thriving, and where we can use that to build towards eliminating the gaps that we see. Because Native people right now, we currently have some of the highest rates of obesity, cardiovascular disease, cancer, diabetes, all of those things. We don't have those more because we're native and there's something wrong with us. We have that because we live in a country that's been trying to eliminate us for more than 500 years. And it takes a decolonizing approach to looking at that information to recognize that, to be able to move forward. And we call that moving into historical healing, to acknowledge that the strengths of who we are in our community. And if their attempts to eliminate us had worked, I wouldn't be sitting here today. But they couldn't have worked because my ancestors fought for me 100 years ago, 500 years ago. They were praying for me right now. And so it is my responsibility to live forward their dreams as I pray and I sing for my children's children.
Thank you so much for sharing that. Speaking of thriving, can you tell us a little bit about your connection, if you have one, with kind of fashion, styling, that part of you? Because it's really, we're going to kind of start delving into the dress, but I was just so curious about your background related to that.
Yeah, so I actually put myself through college and provided for my family for many years as a hairstylist, and was very engaged in the local Seattle fashion scene for quite a while, and worked for some really big salons and was able to actually go and do that on the national scale for a little bit. So I loved fashion. I loved being engaged in that world. I used to do big hairstyle shows, big crazy hair and fun photo shoots and things like that. So it's always been an interest of mine. But most of all, I've always been interested in Indigenous fashion. And so I was raised around these women in these beautiful, intricate parkas that were used all of this fur work to create all of these beautiful patterns. I wore cuspics, which is a type of traditional dress in Alaska growing up. I loved them. I watched my aunties show and make this beautiful appliques and shawls. And I remember one time I was in the Fort Peck Reservation in Montana, and I walked into their grocery store, and in walked the most beautiful elder I've ever seen, head to toe in regalia. And the friend I was with, she said, "Oh, she's never dressed in Western style." It's like, she's stunningly beautiful. These clothes are gorgeous. Why isn't everybody wearing these? And I was blessed to have been grown up with family members who taught me how to make our traditional regalia. So it's always been an interest of mine. And especially looking at the beauty of Indigenous fashion and styling has always been something. I always feel like I always got my Indian earrings on. The very least, I'm wearing some Indigenous fashion at all times in my earrings.
Stunning. I definitely noticed your earrings. They're absolutely gorgeous.
I always got to touch the shoulders. That's the goal.
Yes. So I wanted to delve into what happened that led to the creation of the dress. You took something devastating and created something that represented hope and resilience. Can you tell us what happened that led to the materials that you received to then create the dress?
Yeah, so Seattle, like it said, I was saying in the video earlier, was the original epicenter of COVID-19. The first cluster of cases was in Seattle, Washington, and our clinic, which is a federally qualified health center, was soon inundated with people who were concerned they might have COVID, were experiencing symptoms, did have COVID, and we quickly ran out of PPE, so the masks, the gowns that our folks who are providing this care needed, that was necessary to protect their lives so they could be serving people whose lives were at risk because of COVID-19. And so we put out requests for PPE to our federal, state, and our county public health departments, Indian Health Service, Washington State Department of Health. We were asking everybody, we need these materials now because we don't have what we need in order to stay safe so we can continue to serve our community. And unfortunately, while we were waiting for those, we thought we had received a box. Our staff was excited to get this box. They open it up and they take out the packing receipt and they run upstairs and come to our CEO, and her and I go down. And instead, what we had received was a box of body bags. So I often have thought about that. I keep saying it's a metaphor, but it was literally in front of me, a box of body bags. I remember taking out the first one, and I was holding it and I was looking at our CEO, her and I are looking at this box. Then out of it falls 3 toe tags. And it just was like devastating. Her and I were looking at each other with tears in our eyes. And here we have in our clinical space, just, 100 feet from us, providers who are having to wear hand-sewn masks, which aren't safe in a medical environment. The executive leadership team, we took home scrubs and were washing them in our washers as they were being donated so we could get them to our staff. And here, from the folks who are supposed to serve us, instead, they sent us body bags. And I know across the country for many Native communities, both urban and rural, that's what we are given. They'll give us the stuff to bury our people, but not what we need in order to have them survive and to thrive. And it was absolutely, absolutely devastating.
What was their, response when you brought that up or followed up with them? And yeah, how did they respond to this?
Surprisingly, nobody's admitted it was them. So we have neither the Indian Health Service, the state, we're pretty sure we don't think it was King County, but nobody's, and in fact, the manufacturers of those body bags, because there was a story that was done on NBC News talking about that delivery, and the manufacturers reached out and said, we can't tell you who sent it to you, but we apologize that this was so devastating to you, which was a beautiful thing for them to do. And so, they even felt bad for the fact that it wasn't their fault. They were told to send it to us, but nobody has admitted that it was them, and probably for good reason, because nobody wants to accept the blame. And I wish if they could just think about it like this. If you can just figure out what the hell you did wrong so that we can make sure it never happens to another community. But like many federal bureaucracies, state bureaucracies, nobody's willing to say that it was them.
So how do you go from this space of devastation to coming to, a point where you are rethinking what this is and the materials and to create the dress itself?
It was a couple weeks later, I went up to our CEO's office, Esther Lucero, my partner in serving our communities. And I told her, I said, Esther, we can't do anything with them because we're a community health center. If somebody dies here, we call the ambulance like everybody else. And so I told her, I said, is it okay if I took some home? Because she knows I'm an artist. It's taken me a while to take on that title. I always saw myself as a person who deals with her trauma by creating things. And so I asked her, I said, I might paint with it. I like to paint. I make different kinds of regalia. I like to do traditional arts. And I asked her, I think I'm going to paint it. That's what I had originally thought. And so she said, sure, take it home. Because I wanted to, when I looked at it, I thought, I cannot just let it be a body bag. I can't let that be what they gave us, and that's what we end up with. It can't be that way. And I thought back to my ancestors who walked from Nebraska and Kansas to the Pawnee Reservation, who by, this 1910, there was less than 700 Pawnees left alive. I'm a tangible manifestation of their resiliency. I think about that all the time. They turned things so terrible into something that allowed me to be here today. And so that's been a lot of the work that I do. And in fact, previous to this, when I've done a lot of work on missing and murdered Indigenous women and girls, I created a ribbon skirt, a traditional regalia ribbon skirt, where on all of the ribbons are written the names of the women who are missing and murdered in our data report as part of decolonizing data and bringing humanity back to those numbers. And so I asked her, she said yes. I took it home. I unfolded it. I laid it across my living room. It's pretty big, actually. And I kind of stared at it, and I left it there for 2 days, much to the annoyance of my children, before I began to think about laying fabric in it. What did it feel like? How could I change this into something of strength and use the lessons that my Auntie Shayla Rice, who taught me how to make regalia, showed me, and that is to create things with prayer and always for the good and the well-being of the people. And that's where I started. And it took me about 7 months. It took a long time. And I remember there were some times as I was sewing and stitching and there would be tears streaming down my face, and other times where I could only do a little tiny bit before I had to stop. But it was a way for me to both overcome my trauma and then to recognize that my people deserve better And I wasn't going to let this body bag be the last thing they gave us. I was going to turn it into something that was about the strengths of the ancestors like mine who walked from Nebraska to Pawnee, Oklahoma, so that I could be here today.
Wow. So let's jump into, why did you choose to create a ribbon dress specifically? And can you tell us about, there's so much detail that represents so much within the dress. Can you take us through some of that?
Yeah, so one of the things in thinking about why did I want to do a ribbon dress, one of the things when I was kind of laying it out on my floor and moving it around and squishing it together and kind of playing with the textile, the plastic that was there, unzipping it, zipping it back up, I thought, what could I do with this that would be the strength I needed to see? Because initially I did this for myself, and then as I began to do it, it became something for people. And so as I did it, I was like, oh. And I began to see the shape. And when I was taught to make ribbon skirts and ribbon dresses, one of the things that I was taught is that when you do it, you have to do it with prayer, that each stitch is not always going to be perfect, but life isn't perfect. And you create it as the greatest gift to the people. And so I saw it as a gift back to the people, something that heals instead of something that harms. I was also taught that each ribbon in our ribbon skirts and in our ribbon dresses carries prayers for the people, that it shows our strength. It doesn't say the trauma doesn't exist, but it says we have a way forward. And so I wanted to use those traditional teachings, which are so integral to our fashion, to be able to highlight and show, and for me, heal through this process. And so if we look at the sleeve, especially when we talk about decolonizing data, I'm a co-author on several papers that have been published by the Centers for Disease Control, the CDC, where the statistics you hear every day are coming from about Native people, that we're 3.5 times more likely to be infected with COVID, and that we're almost 2 times more likely to die. And when I see this sleeve and as I sewed it, each stitch are done in red thread because that is the color of prayer. And for the Pawnee people, my people, it was also the first color. It holds a lot of power. And I wanted, as I sewed and I created a pattern on those sleeves out of the toe tags interwoven with the ribbons, that across them, you'll see that there's some jagged stitching. And that jagged stitching is meant to represent the marks that you see on a body after an autopsy, autopsies that are happening as a result of COVID. And I wanted to recognize the disproportionate impact our people are experiencing as they watch the people they love die around them. And so those jagged stitchings represent those that have died. And then you'll see the stitching straightens back out because we don't live in the trauma. We grieve, we move forward, and we heal, and we fight. And we fight to make sure that that next life is not lost. And every morning I wake up and say, get ready to fight because we will not lose another single person. The red hands down the side are a representation of the work that I do in missing and murdered Indigenous women and girls, which is a crisis in this country for the past 500 years. And so as I kind of pressed my hands against it, it was the concern of my partner who said, hey, you can see all your fingerprints. That seems really concerning. I don't think you should do that if anybody's ever going to see this dress. And I called my children over, my 2 sons, who, in the work that I've done on missing and murdered Indigenous women and girls, and I would say even right now, I've actually experienced some lack of personal safety as a result of the work that I do. And I've experienced in my lifetime as a survivor of sexual assault, and also somebody who has felt I could have gone missing or been murdered in certain situations, that it always worried me, is like, how are they going to find me? And so I called my children over and I told them, I said, well, the reason these red hands are there is they're a sign of the movement, the power of prayer, that we're not going to fight and that we're not going to quit fighting, and we will always remember these women. But it also had a very intentional, personal thing, practical, is now if I was to go missing or be murdered, my fingerprints are there. And I told my sons, if I ever do, this is where you'll find my fingerprints that you can give to law enforcement so you can find me. Because if I ever go missing, I never left you on purpose. Somebody took me from you. you can find me this way. And I remember talking to them, I had tears down my face because it's hard to tell your kids that this could happen, and yet it's a reality that my children live with every single day, and they know that this has happened to their relatives. So it had its practical parts and also honoring those in the movement, particularly here in Seattle. I think of Roxanne White, Patsy Whitefoot, others who have been fighting for our missing and murdered Native women. And I wanted to honor them in that dress, show their strength and their power. It's a fight. And then the mirrors are my favorite part. I won't talk about all the pieces of the dress. If people are interested, you can read it in Vogue, in the article in Vogue magazine. But the mirrors were in honor of one of my dear friends. And mirrors in traditional regalia reflect, and they also deflect. And I wanted what they did to us, whoever sent us these body bags, to see the impact that it had. And it was also meant to deflect their attempts to harm us. We will never allow our people to be harmed. We will fight every single day for the health, the safety, and the well-being of our people. And that's what the Seattle Indian Health Board does every single day. When people donate to us, they are supporting this kind of advocacy, this kind of fight, and this dress represents that. And I'll just cover one last thing. I have a picture, actually Jeff might be able to put it up, of I took a picture of the dress in the entryway of the Seattle Indian Health Board in front of a piece by Louis Gong, an incredible Nootsack artist. And I took it there on purpose because Louis' piece is titled The Guardians. And one of the things we do here at the Seattle Indian Health Board is fight to protect our people so they don't have to experience discriminatory health care, that they're loved, that they're protected. And this dress is under the watch and is part of being part of that guardian, which is why I had it taken in this lobby, to recognize that when I think of art, as a Native person, art lives, it breathes, it speaks, it carves, it sings, it's poetry, it's visual. And it also, for Native people, our art does not live alone. It speaks to each other. And so in this, I saw this dress as part of what Louis had created, and that he had created something that was a guardian. And because of the guardianship we hold, I could create this other piece of art.
That gives me chills. Wow. I'm thinking of, words like protection and reflection and honoring, those that came before you, some of the mentors that you mentioned, and also creating the pathway for those who are going to do incredible work, and the pathway that folks like Adeline paved the way for. So just incredible. Thank you for sharing that. The dress has garnered so much attention, locally, nationally, and has kind of provided a really incredible platform for conversation. What has that been like to kind of receive this much attention, and what kinds of conversations have been coming up as a result of this?
It was shocking, truthfully, especially since when I was doing the interview originally for the Vogue article, she asked, well, where do you have it? It's like, it's hanging off the tiny basketball hoop on the back of my living room door, because I would walk home and then, we have hard days here. It's hard. We're fighting for our people's lives every single day. And I would just walk by and I would touch it, just graze my fingers across it so I could feel its strength. And then to see it kind of in this public sphere, I was terrified, truthfully. But the response has been so overwhelmingly positive. I've had folks ask to have it put, to show it and things like that. But I really wanted it to be something for Native people. So if at some point I do decide to show it, it's got to have a place where Native people are the ones who get to come and be a part and brew with it. And so it's been great to see. And also, I didn't realize it was going to help elevate the conversation about the disparities we're facing, both for missing and murdered Indigenous women and girls, and also in COVID-19. And so it has brought awareness that I couldn't have been more blessed to see that folks started talking more and understanding more that Native people in this country, we deserve the treaty and trust responsibilities that our treaties said that we were to have, and the federal government has not been providing those. So it's been an honor to see that. I would say I was super shocked that anybody was interested in the things I create at home in order to make it through my day. But it has allowed me to tell stories in a new way. And I think about the Decolonizing Data, those autopsy stitchings that I have on the sleeves, they tell more than the 3.5 more likely to get COVID statistic. So it's allowed us to really bring our stories in a different way.
Definitely. The power of art and creative making.
Absolutely. Nothing more powerful.
And you declaring yourself an artist, which is also really powerful as well.
And new. I'd never seen myself in that way. I've been doing these kinds of things for many years, again, more for my personal healing. And I would say I was pretty surprised to be called an artist outside of my own family.
You know, related to that, how has the process of creating this piece and going through this process, how has it affected or changed you and your perspective?
Well, I think one of the things that it helped for me, truthfully, was in the process of doing it. Like I said, a couple of weeks ago, I testified in front of Congress. The Seattle Indian Health Board has been doing this for many years. This Thursday, I'll be testifying in front of Congress again, getting ready to let them know how we need more resources in order to protect our people. And so often I hear people arguing against that. And so it has really, in a sense, more affected my ability to, and we were taught that as Native people. We always knew how to grieve. We always knew how to heal. Our art was never something that was just meant to be beautiful on a wall. It was always meant to tell a story and to tell multiple stories and speak to the piece of art behind it, like Louie's piece, or beside it. It holds spirit. And so what I found is that I was able to heal and be able to be somebody who can testify in front of Congress and have people say, oh, that doesn't matter, and then get ready to do it again on Thursday. And so what I've continued to learn is that our ancestral ways of knowledge, of knowing, of healing, of medicine, those are what make our people strong, and that's how we'll survive this pandemic. And that is who the Seattle Indian Health Board is. We are grounded in those traditional ways. And it also taught me how blessed I am to be in a place where that is not only valued, but it is where we are centered. And that's what makes us different. And that difference is highlighted not only here locally in Seattle, but nationally. We are known as an organization who will be in front of Congress testifying, fighting not just for the people in Seattle, but for every Native person nationwide.
Thank you. You touched a little bit on this, but my last question for you is, what do you hope for the dress? What would you like to do with her?
I love that you gave her a pronoun, because I have to. And, it's also really important to me that it also represent the fight of our LGBTQ plus two-spirited community, who disproportionately are impacted by both COVID, every kind of health disparity, and for missing and murdered Indigenous peoples. They are one of the ones who are most impacted by that. And so it was something that I also wanted to include in that. And when I think of this beautiful piece of art and spirit that I was able to, I felt like my ancestors' hands were on top of mine, guiding each thing that I was doing, is that I hope it brings story. I hope it brings conversation. And I hope it brings tears so that we can begin to heal and move forward. Because this kind of violence our community has experienced, both by the disproportionate impact of COVID-19, of our loved ones who have gone missing or been murdered, we have to overcome that and fight for it, and remember that we are the tangible manifestation of our ancestors' resiliency. That is who we are. And I hope it brings healing, and that it can live in a space, and I don't know where it's going to live next, but I know it's not meant to stay with me. It's meant to live somewhere else. And I don't know where that is yet, but she will find her home, and I assume it's probably going to be one that changes as different nations, different communities, different people need to experience the healing that she can bring.
Beautiful. Thank you so much for sharing with us such a powerful story of hope, resilience, and ownership of the power of your culture and how it brings you direction and healing. So thank you so much for sharing with us. This is something that I'll carry with me for a long time and come back to. And I think for all of us that are listening and watching, that others feel the same. So thank you so much. I'm not sure if we have any questions or if we should bring it back over to Howie, but thank you, Abigail. What a beautiful lunchtime and the best one I've had in a long time.
Well, it has been a privilege and honor to speak to you. We've known so many mutual people and be like, you got to meet Priya. So it's nice to meet you in this place, and I hope to meet you in another space. And I do want to encourage people to think about donating to the work of the Seattle Indian Health Board. It is so integral to, again, not only this community locally, but to what we can do nationally. And the more we have support and resources, the more we can do to ensure that nobody ever sends us body bags. We are only ever seen as strength and resiliency.
Great.
Thank you all so much for watching that conversation. Thank you so much, Priya, for agreeing to be a part of this. That was a really fantastic interview between you and my sister. Really appreciated it. So everybody's still watching, please share this video and tell your friends to watch this amazing conversation that happened today and to donate to the Seattle Indian Health Board. Alex, I'm glad that you're here and we're able to hear Abigail's story. But please, donate. We have a goal of $100,000. This is such a vital resource for the Native community and for so many other communities. If you get your healthcare in Seattle, you can go to the health board. You can go there and you can receive amazing care from our doctors, and in a truly a wonderful environment. It's a clinic unlike any other. Tomorrow we have an interview with Abigail Johnny, who is one of our honorees. So please tune in tomorrow, 12:30 to 1:30. It's reflections on the future of Indigenous leadership. Abigail will actually be interviewing Abigail. Tell your friends, invite them over to watch it outdoors, far away from each other. I don't know. But thank you all for tuning in. Please, again, share the event. And I think that will be it. Jeff, why don't we go ahead and cut to the last thing?